All right. So, our major categories of disease when we talk about the disease and treatment. So, we have infectious diseases that are going to be caused by harmful microorganisms and parasites, degenerative diseases that will result from wear and tear, aging, and trauma, neoplasia, which is going to be the abnormal and uncontrolled growth of our tissues, immune disorders that are going to result as a failure in the immune system. So that basically our body makes antibodies to its own tissue. So we attack ourselves. Metabolic disorders are going to result from the lack of enzymes and other factors that are needed. Hormonal disorders are going to be caused by an underproduction or overproduction of your hormones. And then mental and emotional disorders are going to be those that are affected by the mind and the adaptation of an individual for their environment. Some of our responses to the disease. So, whenever we're looking at medical terminology, the inflammation suffix of itis, then that's going to be that localized response to tissue and that is categorized by heat, pain, redness, and swelling. If we have phagocyte, then that word root is going to be phago, and that's going to be the ingestion of organisms such as the invading bacteria or small particles of waste material by a cell. So that phagocytic cell that is then going to destroy that material that it ingests. And then when we talk about the term immunity, then that's just going to mean overall the defenses against our infection. Neoplasm, so we have kind of already touched on that. It's just going to be the abnormal and uncontrolled growth of tissue. So we have two different kinds. Our benign neoplasms, that's going to be a non-recurrent or malignant. It's typically going to be favorable for recovery, so it's not going to spread to other tissues. Um, and then your malignant, this is going to be the one that you hear about all the time when someone says that they have cancer. Those are going to be those that grow, they're going to be harmful, and they will tend to cause death. Now, your malignancies are kind of broken down a little bit further. You can have two different other types that are just not just malignancies. But a carcinoma, that's going to be a malignant neoplasm that's composed of the epithelial cells. So those will typically be like found in the skin. And then your sarcoma, that's going to be ones that are found within connective tissue. So like your ligaments, your tendons, and your joints. So our word roots for diseases, you have again some meanings in the middle that are for like pain, cancer. Cysto is going to be for a filled sac. So it's just going to mean like a cyst. So if something is cystic, then it's pertaining to having a cyst. Onco, that's going to be for a tumor. So oncogenic. So if you look at your suffix for genic, then that just means causing. So oncogenic is causing a tumor. Pyo is going to be for pus. So if you have a pyocyst, it's going to be a cyst that is filled with pus. And then your sclero is going to be a hardening. So sclerosis is going to be the hardening of a tissue. Some prefixes that are specific to diseases. So Brady is going to mean slow. So bradyapnea, that's going to be the slow breathing rate. The opposite of that is going to be your tachy. So that means you're rapid. Your tachycardia is going to be a rapid heart rate. Mal is going to mean bad or poor. So if something is malabsorptive or malabsorption, there's going to be a poor absorption of those nutrients. And then our suffixes for diseases. So your algia or your esia, again, can mean pain. We had that same one up here that was a word root. So you'll see sometimes your word root are going to be used for your suffixes as well. Your itis, we've already gone over that one, is your inflammation. Megaly is an enlargement. So the hepatomegaly, that's going to be just an enlargement of your liver. Pathy, that's going to be a disease of. So nephropathy is the disease of the kidney. And then you'll see here, these are actually not listed as your double R's, but these are the same ones that we saw earlier, the rash, the the rhea, and then your rexus. And then again, you can have some of those just straight words that are used as your suffixes. So I'm not going to go through all of these because they're starting to see that they are kind of duplicates of ones that we've already gone over. But just know, and I'll send these slides out to you guys. I typically will have them in the folder ahead of the session. But I didn't have a chance to get those in there tonight because I was still working on them. But I will make sure that the ones for next week are put in there by at least Sunday. So the beginning of the week for next week's session. And then we've got our prefixes and suffixes. So some of these can be either or for infectious diseases. So staphylo is going to be your grape-like cluster. So a staphylococcus is going to be a round bacterium that forms in clusters. So it basically is what that bacteria or that infection looks like underneath a microscope. Myco is going to be in the or is going to be fungus or mold, and so it's something that's mycotic is going to be pertaining to a fungus. Tina, those are going to be in that the OneDrive folder that I had sent out in the email. I can send that to you guys again for that link if you don't have it, or if you like misplaced that email. But they'll be in that folder where all of the other like resources and things will be. Do you still have that email by chance, or do you want me to send that out again?
I think I have it still.
Okay, I'll go ahead and just I'll go ahead and send it out again, just that way you guys have it again. And then make sure you just kind of bookmark that page too. I know I have mine bookmarked, and then like that parent folder for everybody. But I will put that, I'll get that link out there to you guys again. Making a note here to get that to you. Send the OneDrive. And then upload. You all will notice if I do not write it down as I say I'm going to do it, then I will forget completely. Week 1 and 2. All right. So now we're going to talk a little bit about, maybe if my computer will, there we go. We'll talk a little bit about like the diagnosis and some terms and types or and ways to diagnose conditions. So a diagnosis, the official definition is going to be that determination of the nature or the cause of an illness. So we can use many different ways to diagnose them. So an inspection is going to just basically mean that we're going to take that visual exam of the body. We're just going to look and say, yes, that patient has a rash on their arm. Or there's, yellowness of the eyes that will typically go with like liver failure. Palpitation, that's just going to mean that we're going to touch the surface of the body with the hands or fingers. So the capillary refill, if someone was to touch and apply a little bit of pressure to just the top of the skin and then let go, you see that I'm doing it on my arm now. So like you'll see that it's a little bit lighter, and then those capillaries, as they start to refill, then they'll get back to the same color of what your skin is. Percussion, That is going to be tapping the body to evaluate tissue according to the sounds produced. So if you go to the doctor and they tell you to lay down on the table, and somehow, I don't know how they do it. I know that they obviously went to school for, it seems like 18 billion years to figure out, they know what they're doing and they know what they're supposed to be hearing, but they tell you to lay down on the table. They put their hand on your stomach and then they tap their hand and they can just magically hear everything, that's going on inside of your body. That's going to be your percussion. And then your auscultation, that's going to be when they take that stethoscope and listen to your lungs. They listen to your heart. They listen to your bowel movements, things along those lines. And then some of the other things that play into diagnosing a condition are your vital signs. So your temperature, your pulse rate, your respiration rate, and then your blood pressure. Sorry, I keep clearing my throat. I've got allergies really bad, and I can tell my voice is starting to kind of go out a little bit. So that's why I keep kind of like taking a couple of extra, seconds in between some things because I'm trying to drink some water and keep my voice going at least for the next hour. Um, so our diagnosis imaging techniques, here you'll see different types of techniques that they can use for like radiology. You'll have your CTs, your MRIs, your PET scans. This just gives that full official description of what they all are. So your CT is going to be a three-dimensional image of cross sections of the body. It's going to tell us more about soft tissues, whereas the magnetic resonance imaging or your MRIs, those are going to be a magnetic field where you have your soft tissues again are going to be revealed by differences in their molecular properties. So they each have their own things that they look at. Um, Typically, if there is a large accident and the patient is completely unconscious, then they will typically elect to do a CT versus an MRI, because if there is any metal whatsoever in the body, then an MRI is going to pull that metal out. So it's essentially a big magnet. So if they are not sure if the patient has any metal whatsoever in their body, whether it be a piercing, a joint replacement, a stent of some kind that's made of metal, then they'll put the patient in the CT machine so that there's not that risk of pulling out that metal. And then just here's three others. You have a scintigraphy, a SPECT, which is going to help when you have cancer, and then your ultrasonographies or your ultrasound. So once we have a diagnosis, then that's when our treatment or our therapy will begin. So if we are doing palliative therapy, then that's just going to mean that we're providing some relief, but it's not intended to actually serve as a cure. So the first type of treatment that we can do is surgery. So we can either cut in and excise that tissue or cut in and do whatever we need to do. We can cauterize if we need to by heat or chemical agents, or like a fixation. So like some people have to have that bladder spleen. Typically it will come with old age or multiple pregnancies. So that fixation or that fastening, that can just kind of hold that structure or that organ in a firm position. Our alternative and complementary medicine. So these are going to be types of treatment that are going to go together, or instead of medical care. So osteopathy, that's just going to be a system of therapy that's based on the theory that the body can overcome its disease when it is basically reset and is given proper nutrition. Naturopathy, that's going to include a therapeutic philosophy on helping people heal themselves by developing that healthy lifestyle. So changing diet, changing habits, changing pretty much anything and everything they can to kind of help reset again those certain aspects. Homeopathy, that's going to be a philosophy of treating disease by administering drugs in highly diluted forms. So it's very similar to like just normal medicine, but again, they're very diluted. So it's not like overshocking the body with antibiotics or pain medications or things along those lines. And then our chiropractic, that's going to be where the nervous system and the spinal, basically anywhere that there's a joint. So the spinal column, your hips, your shoulders, your elbows, your knees, all of those joints, those can be manipulated in certain ways to help relieve pain. When we talk about cancer, then we have to classify that cancer in order for us to be able to treat it properly. So when we classify it, we're either going to stage it. So we're going to say if it's stage 1, stage 2, stage 3, and then grading as well. So that grading is going to be microscopically being looked at, whereas staging will typically look at like different, like the body as a whole, to determine it has spread or invaded other parts. Some treatments for cancer are going to be our chemotherapy. So where we use those chemicals, you have to go in, once, twice a week and do an IV and sit there for a long amount of time. Immunotherapy, that's going to be something that can be done typically in conjunction with chemo. And then you also have like radiotherapy and things too that I didn't list on the slide. Your remission. So basically, if there is a period when there is no sign of that disease or that cancer, then that will typically, be able to say that that patient is in remission. They no longer have evidence of the disease, and there may be potential that it can recur. But for the most part, if you're in remission, then you know, it's usually only for a short amount of time. So we have some word roots for physical forces. So like meaning the air, the wind, electricity, light, sound, things along those lines. Again, I'm not going to sit here and just kind of read through all of those. These are also found in your textbook, which is where I pulled all of these all of these grids and things out. And then we've got suffixes for diagnoses. So some that we've already seen, like your graph, your graphy, scope, and scopy. You can see that those are essentially the same things. One is just the instrument for however we're going to do it. And then the one that ends in the Y is going to be the actual act of recording or examining or measuring or something along those lines. And then our suffixes for surgery, we've seen some of them before. So our centesis is just going to be a puncture of the chest. So the word centesis is that puncture of the chest. Plasty is going to be your plastic repair. Your raphy, again, is going to be that suturing or the surgical repair. Your tome is going to be the instrument for incising, whereas your tomie is going to be the actual incision or the cutting. Okay, so now we're going to talk about some of the drugs. Well, not some of the drugs themselves, but just effects and things that can happen with drugs. So adverse effects of drugs, those are just going to be an unintended or off-target effect of that drug. So something that is not expected to happen. So a contraindication is a factor that just makes the use of a drug undesirable or dangerous. So those are the ones that whenever you're hearing, the commercials of do not use this drug if you are allergic to the drug itself or any of the ingredients. So those are going to be considered contraindications. Anaphylaxis is just that extreme allergic reaction. So obviously that's going to be a contraindication of it because we don't want someone to go through that because it can cause circulatory collapse and that death. Synergy is going to be when they combine two or more drugs so that they work together to produce a greater effect than any of the drugs could produce when acting alone. So the biggest one that they use those in conjunction with are going to be like your antidepressants, because you can use an antidepressant and then you can have that additional drug that will just kind of help boost the effect of that antidepressant. Another one that they can do that with is like your allergy medication, or like headache medications and things along those lines. Something that is an antagonist is something that will interfere with or oppose to the action of a drug. The most popular one is if you're on blood pressure medication, you are not supposed to drink or eat grapefruit. Um, so that's the biggest one that you'll hear a lot is, or you'll see it on, the bottles is don't take this within X amount of time of eating grapefruit, or, X amount, or the opposite, don't drink or eat grapefruit within, I think it's like 4 hours of taking the medication or something like that. It just kind of it's something within whatever the contraindication is, like something within that substance will interfere and stop that medication from working correctly. And then whenever we talk about like pain medications, opioids, opiates, things along those lines, you can have substance dependence that does come along with them. So, those whenever you do discontinue those drugs, then there will be a withdrawal that happens from them. Um, but typically the reason that your substance dependence does happen is because your body builds tolerance. And so in order for you to get the same effects of that medication, you have to take an increased dose, and then you have to take more, and then you have to take more, and then that turns into that dependence. And then subsequently that withdrawal comes with it. When we talk about drug names, then you'll have brand names and generic names. So our brand names are going to be that proprietary name of a drug, such as like Tylenol. But then if you go to, Walgreens or Walmart or Kroger and you get the generic of it, then it's going to be acetaminophen. It may say compared to Tylenol because it is the same ingredients of it, but it's not being branded underneath that proprietary name Tylenol. And then lastly, here we do have some drug administration. So some of them are going to be by absorption. So meaning that it's either on the skin, or it goes through the mouth or through the rectum. And so it's going to be absorbed. Whereas you do have some administrations that are done by injection. So you've got an actual injection itself, but then you've got different types of injections. You've got intradermal, intramuscular, intravenous, depending on where that substance is injected.